I'm Cynthia White. I'm part of an orthopedic clinic that has decided that it was time to get an electronic health record. Along with Courtney Thompson, we have been given the task to research, compare, and recommend an electronic health record for our mid-sized orthopedic clinic, which consists of 5 doctors, 5 nurses, and 3 administrative staff members. The clinic sees about 150 patients a day. We looked at a vast number of electronic health records out there and narrowed the field down to what we felt were the 2 that would best fit our practice. These are Epic and Practice Fusion.
I'm Courtney Thompson, and I'll be reviewing the features of Epic. Epic is a privately held healthcare software company. It is usually utilized in large organizations and academic medical centers. Epic system is used by community hospitals, academic medical centers, children's organizations, safety net providers, retail clinics, multi-specialty groups, integrated delivery networks, rehab centers, skilled nursing homes, hospice agencies, and independent practices.
Practice Fusion is an electronic healthcare record owned by a private healthcare information technology company, Practice Fusion Inc. It is a cloud-based electronic health record that is free for its users and supported by its advertisers. With this electronic health record, providers can chart on any device, anywhere. Practice Fusion provides users with templates that can be customized to the medical practice. It can be used by any physician, office, or clinic, in practices as small as 1 doctor or as large as the largest practice imagined. It is not used in hospitals.
The Epic system is owned by its employees and led by its developers. Epic software is built in-house by the company and its developers. Epic functionalities include electronic documentation, provider order entry, and e-prescribing functions. Epic inpatient care supports extensive clinical decision capabilities, including drug-drug, drug allergy, and drug formulary checks, clinical documentation capabilities allowing users to document, review, and edit patient demographics, vital signs, problem list, medication allergy list, electronic notes, smoking status, and family health history. The Epic medical system is able to store data in the form of lab reports, patient encounters and messages, physician orders, prescriptions, clinical visit summaries, surgical records, and imaging results. Epic also stores medical billing information and patient scheduling.
Practice Fusion functions as a cloud-based electronic health record. Practice Fusion stores its data in templates that can be customized for any physician, clinic, and specialty. It is free to its users. Practice Fusion allows its users to chart on patients, use e-prescribing to send prescriptions to pharmacies, order lab and imaging tests, along with receiving the results directly into the electronic health record. Its abilities include scheduling, billing, referral management, and secure messaging. It has a patient portal which allows patients to stay informed.
Epic is 100% HIPAA and HITECH compliant. All clinical and non-clinical Epic users are assigned a unique username and login. Epic also carries single sign-on capabilities. This allows for healthcare workers to use their employee ID badges as a tap-and-go function to sign on to Epic without entering a username and password. For patient portal users, patients can create a username and password specifically for their portal login, or they can use an existing username and password if they have one of the following accounts: Facebook, Gmail, Yahoo, or Windows Live. The Break the Glass feature ensures HIPAA regulations are followed. Medical personnel that should not have access or only have limited access to patient records must break the glass before entering the chart by entering a password and documenting a reason for entering the chart.
Practice Fusion is a 100% HIPAA and high-tech compliant electronic health record and is meaningful use certified. At the user level, it uses SSL TLS encryption and has HL7 standards. Patient Fusion requires and enforces the use of strong user login passwords, has strong user identification, and login and inactivity timeouts. At Practice Fusion, there is a biometric security system in place, the data is backed up, there is a continuous surveillance system, and redundant power supplies.
Evidence-based medicine is an approach to medical practice intended to optimize decision-making by emphasizing the use of evidence from well-designed and well-conducted research. EPIC's evidence-based practice features include best practice guidelines that help to drive decision-making, such as physician orders, treatment guidelines, and discharge planning. EPIC's best practice is a pop-up feature that prompts certain meds to be ordered and certain orders to be placed based on a patient's diagnosis. The Lexicom integration is a clinical drug reference library in the medical administration system. Within EPIC, Lexicom provides drug reference links to clinical information about medications that appear on the MAR and in the order entry section of the EMR. Using Lexicom within the order entry section allows physicians and other prescribers to conveniently review the entire spectrum of the Lexicom drug information, including drug interactions and adverse reactions. The Lexicom online drug reference within the MAR also allows nurses and advanced practice nurses and other caregivers to review administration details.
Practice Fusion supports evidence-based medicine. Practice Fusion integrates a clinical decision support system into its dashboard that will open prompts to alert physicians of any screenings, lab work, imaging, or medications that may be needed based on the patient's diagnosis. These alerts are based on the best practice guidelines. Also, integrated into the system are alerts to show possible drug allergy or drug-drug interactions when e-prescribing. Medline Plus is integrated into every diagnosis, lab result, or medication window to provide resources to both the practitioner and to the patient.
EPIC addresses the Institute of Medicine's goal of patient-centeredness. With the introduction of Patient Portal and MyChart, patients are able to communicate with their physicians via messaging, making appointments online, and have access to their medical records. The EPIC system also includes patient education for inpatient and outpatient education and discharge planning. In including the features of care at a distance or care everywhere, EPIC meets the goal of safety. Care Everywhere allows providers to have access to patient records that are anywhere within the EPIC system, not only at their facility. The medication ordering and administration feature provides hard stops for incorrect dosing on medication. EPIC also meets the goal of efficiency by providing the features of best practice notifications that provide recommendations for patients, surgical patients, and patients with certain diagnoses. EPIC also fulfills the meaningful use area of ensuring adequate privacy and security protection for personal health information. EPIC also fulfills the areas of improving quality, safety, efficiency, and reducing health disparities.
Practice Fusion advances the Institute of Medicine's quality goal of safety. Practice Fusion uses e-prescribing to reduce the potential for medication errors. When prescribing medications, alerts are given for potential drug allergy or drug-drug interactions. Practice Fusion increases quality and efficiency by tracking various aspects of patient care. If any diagnostic testing, immunizations, or medications are missing that could improve patient health outcomes, an alert is given. Patient Fusion is patient-centered. Practice Fusion has a patient portal where the patient can access his medical record, clarify medications, request refills, look at patient education, and schedule appointments. Practice Fusion is 100% HIPAA and HITECH Act compliant. using the most up-to-date technology to provide privacy and security to the electronic health record. Practice Fusion keeps updated clinical quality measures on its dashboard and sends alerts if a patient needs something to improve their health outcome. This also allows physicians to track their own progress for meaningful use certification. Practice Fusion participates in electronic health information exchange. Physicians can order labs or imaging tests and receive the results directly into the electronic health record. Prescriptions are submitted electronically and referrals sent through direct messaging.
Mobile health is the wave of the future of medicine. Epic includes mobile health features that are compatible with Windows, Apple, and Android operating systems. The Epic Care System integration with video enables real-time video interactions between clinicians and their patients or peers directly within the Epic Care System. Epic System has also partnered with Apple for a mobile phone-based electronic health record application called Haiku and has made it available on the Apple App Store. Haiku provides authorized clinical users of Epic's electronic health records with secure access to clinical schedules, hospital patient lists, and health summaries, test results, and notes. Haiku works on both iPhone and iPod Touch and is also available on the Android system. Epic Cantu is the iPad version of Haiku. Epic also has the MyChart app available so that patients can access their medical records on their personal mobile devices. Other mobile features available through Epic is Epic Rover. Epic Rover is a mobile app that allows clinicians to record, document, and conduct barcode validation at the bedside. Rover is available on iOS, Android, and other mobile platforms. Rover connects in real time to Epic's central database, providing access to other information held in the Epic system, like patient lists and patient charts. Rover displays relevant medication advisories at the point of care, supports recording of vital signs, and provides a clinical summary of allergies, labs, current medications, and intake and output. Rover allows nurses and phlebotomists to complete specimen collection workflows on a handheld device with an up-to-the-minute draw list, barcode scanning for positive patient and specimen identification, label printing, and quick specimen collection documentation. The Epic Limerick app enables doctors to review alerts via Apple Watch that will alert them to patient test results and allow them to view results immediately.
Practice Fusion is expandable and flexible. Since it is a cloud-based electronic health record, it can be accessed by any computer, tablet, or smartphone. The full electronic health record is available, no scaled-down versions, no apps necessary. With unlimited cloud storage available, Practice Fusion can grow and store an unlimited amount of data and service any size of practice.
So what's the cost to invest in Epic? For a practice of 3 physicians that see 80 patients each week with a total of 3,000 registered patients, the base cost of Epic is $6,660 with a 3-year maintenance fee of $4,994. This includes system updates. Although Epic includes many features that would be great for any practice, let's keep in mind that Epic is mostly used in large organizations and academic facilities, as opposed to smaller facilities that may not require the use of all Epic features.
There is no long-term investment with Practice Fusion. The setup, licensing, and maintenance costs, along with all future updates, are free to the user. All costs of Practice Fusion are paid for by advertisers. The only investment that the user will need is the cost of the equipment, the computers, tablets, and smartphones that are used to access Practice Fusion. Practice Fusion and Epic are both excellent electronic health records. Practice Fusion is the #1 rated free electronic health record. Epic is used in institutions across the world. Either Epic or Practice Fusion would work for our clinic. Practice Fusion is an electronic health record that is designed for physician offices and specialty clinics. Epic does work in these practices, but specializes in large institutions and hospitals. In a small to medium-sized clinic, the cost of Epic, in comparison to the free status of Practice Fusion, would be the deciding factor in recommending Practice Fusion for this clinic.